One of the most fascinating facts about troponin is that it's not just a laboratory marker, it's a molecular switch that literally controls how your heart beats. Yet it also serves as one of the most powerful diagnostic tools in modern medicine. Let's start with the basics. Troponin is a protein complex found in cardiac and skeletal muscle. It has three subunits. Troponin C, it binds calcium. Troponin I, it inhibits actin-myosin interaction, and troponin T binds the troponin complex to tropomyosin. So we know in tests, troponin I and troponin T for acute myocardial infarction. Yeah. Together, all these three, they regulate the contraction of muscle fibers when calcium enters to the muscle cells. Actually, troponin C binds it, causing a conformational change that allows actin and myosin to interact and generate contraction. But let's forget about troponin C. Let's talk about cardiobiomarkers, i.e. troponin I and troponin T are unique to heart muscle. That means when heart cells are damaged, for example, during a myocardial infarction, so-called heart attack, troponin leaks into the bloodstream. Normally, we do not have troponin. Even a tiny rise can indicate microscopic injury to the myocardium, making troponin one of the most sensitive and specific biomarkers in our medicine, clinical medicine. In fact, before troponin testing, I remember this time, became standard. Diagnosing a heart attack, myocardial infarction was often uncertain and relied on very less specific markers, CK, MB fraction, and ECG data, of course. Now high-sensitive troponin assays can detect levels as low as a few nanograms per liter, allows clinicians to identify heart injury within just few hours of a symptom onset. However, here is an important twist. Elevated troponin doesn't always mean a classic heart attack. It can also rise in other conditions, myocarditis, pulmonary embolism, renal failure, heart failure, or even after strenuous exercises, reminding us that the context is everything in interpretation. Yes, but even in these cases, we have, doesn't matter, we have myocardium damage. So in both molecular switch, it's troponin, it's both molecular switch that makes your heart contract and a clinical signal that reveals when your heart is in danger. Doesn't matter, it's a myocardial infarction or myocarditis. High elevated troponin is a very bad sign. It needs your maximum attention. Okay? Stay blessed.